Welcome to the short video on personality disorder. This is the 7th and final video in the series, and this is a resource for healthcare professionals. In this session, we're going to learn more about antisocial personality disorder. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. What are the features of antisocial personality disorder? If you can't list the features and traits of antisocial personality disorder now, think back to when you've met somebody with antisocial personality disorder. How have they presented to you? Those who work in police custody will probably have had many interactions with patients with antisocial personality disorder, though often it's not formally diagnosed. And that's because a significant proportion of people who are involved with the criminal justice system have antisocial personality disorder. So I'd like you to pause the video and write down your answer to these two questions. So I've listed the main features of antisocial personality disorder on this slide. I haven't listed all of them, and you don't need all of these to be able to make the diagnosis of antisocial personality disorder. Lack of empathy and lack of remorse. That means people don't feel guilty when they hurt another person. They're unable to empathize with that other person. Prone to external blame. So often those with antisocial personality disorder don't think they have a problem. They believe the problem is with everyone else, so it's a tendency to blame others. Everything is someone else's fault. A callous disregard and violation of other people's rights and social norms. So that will include behaviours such as lying, fighting, stealing, violence, being manipulative. A low tolerance for frustration, impulsive, and those two together may lead to violence and aggression. Incapacity or difficulty in maintaining relationships. And there may be evidence of childhood conduct disorder. And the features of childhood conduct disorder include antisocial behaviours such as violation of rules and social norms, cruelty to animals, fire setting, aggression towards people. And again, as I've already mentioned in the EUPD videos, the same applies to antisocial personality disorder in that many of the patients who have antisocial personality disorder have experienced trauma throughout their lives. They may have experienced adverse childhood experiences and may have had attachment difficulties with their parents or their primary caregiver. And although the picture here is supposed to be of a girl being abused, of course, antisocial personality disorder is far more common in men than women. How might antisocial personality disorder develop? As with any personality disorder, there's no single cause, and the development of personality disorder depends on biological factors, psychological factors, and social factors, as I've already discussed in video 1. One way we can try to understand the development of antisocial personality disorder is to think about the following case. A child experiences early parental abandonment. Let's say the father leaves unexpectedly and causes massive disruption to the child's life. The person who is supposed to always be there has suddenly gone. This means the child no longer feels safe and secure. The experience of parental abandonment is extremely hard to understand for the child who's not developmentally mature. And it's incredibly painful emotionally. So the child learns early in life that emotions are painful. The child learns to numb emotions at an early age because they know emotions cause them too much pain. The child doesn't learn to understand emotions in themselves and other people. And if the child can't understand emotions or doesn't understand why someone else might get upset by their actions, for example, if they steal their possessions or hit them, then that means they can't empathize. And that lack of empathy, the lack of remorse or ability to feel guilt, was one of the features of antisocial personality disorder, which I've mentioned on the slide before. So the lack of empathy and not being able to understand fully that the consequences of their actions may hurt other people, may lead to the patient with antisocial personality disorder finding themselves repeatedly getting involved with criminal activities and not being able to learn from those mistakes. And the child learns that it's less painful not to form attachments with people because people can abandon them, and that's too painful. And that leads to difficulty maintaining relationships in later life, which, as I've already mentioned, is another feature of antisocial personality disorder. So briefly to talk over the treatments of antisocial personality disorder, as with EUPD, psychological therapy is the main treatment that can be offered, and there is some evidence behind that. Also promoting self-management and self-responsibility. Generally, hospital admissions or admissions under the Mental Health Act, so that's compulsory admissions to hospital, are avoided unless the risk of suicide is so high, or if the risk to other people is very high, or perhaps some other reasons. But generally, we do try to avoid hospital admissions for personality disorder unless there is a significant risk to themselves or others. And as I've already mentioned in the last video, there are no medications which are licensed specifically for personality disorder. You can't treat a personality disorder with medication. So that takes us to the end of this webinar series on personality disorder. As a further reading suggestion, I recommend finding some videos or material around adverse childhood experiences, ACE, or attachment theory and the links with personality disorder. And as I've mentioned in video 2, the focus of this series was on mostly emotionally unstable personality disorder and a bit about antisocial personality disorder, as these are the two personality disorders which are most frequently encountered. However, there are other types of personality disorders, as I've mentioned in video 2, like paranoid personality disorder, schizotypal personality disorder. And I've added a link to a useful resource about the other types of personality disorder in the second video description. Thank you for listening, and if you found this video helpful, please like, subscribe, comment, and don't forget to check out the other resources on my channel.